Good morning, good afternoon, good evening. I am Dr. Puigieng, and today we will be talking about music as a medical treatment, music as a therapy. The same way when you're sick or when you have a problem, the doctor prescribes you tablet, the doctor prescribes you physical exercise, he could also prescribe you music. Yes, and it is not something of today, it's something that is as ancient as we can remember. In the Bible, for the Christian, we know it is written that King Saul used to call for David to come and play the lead for him, which will relieve him from some evil spirit that used to disturb him. And modern science establishes that today, those evil spirits were probably symptoms of anxiety or depression. So music can be used to relieve depression or anxiety. Anesthesia. When you're scheduled for surgery or for a major operation, it is noticed that you have your heart that beats very fast, you're very anxious. And research has shown that music played in the period of time prior to the intervention and played during the intervention reduces anxiety, reduces the heart rate, thereby reducing the amount of anesthesia and pain medicine required during the intervention and after the intervention. Thirdly, let's talk about grief. When you have lost a loved one, when somebody very dear, precious, somebody you love so much dies. In our culture, the grief process is usually accompanied by some music and some dancing processes performed in unison all together, which help people go through the grief process. And if you notice in our villages, we rarely, not to say never, hear about denial. We never hear about depression after someone is dead. And it is because the grieving process had some music and some dancing all done together as a family or a community incorporated into the grieving process. Rehabilitation. When somebody is paralyzed, when somebody has suffered stroke and he's sent to a physiotherapist for exercise that will help him build back some movement, build back some muscle tone. Research again has shown that music improves the speed and the quality of rehabilitation because it has the effect to motivate the patient, to give him a sense of rhythm, to give him a sense of persistence because the music kind of locks him into the cycle or into the repetitions that he does, thereby reducing the abandon rate, reducing the speed at which he gets exhausted, and encouraging him, making him to push through the difficulty or the pain that he encounters during the rehabilitation. Physical exercise and workout. I'm sure many of you listening to me have been to the gym before, and one thing that is characteristic of workout in a gym or in open air is that there's always a loudspeaker that plays some music. Do you imagine working out in the gym where you have paid in some money for and the loudspeaker is broken one time, two times, three times? Will you keep paying the money? I guess no, because you are aware, you are conscious that that music boosts you, that music gives you some energy, it gives you the will to push through the pain, to continue during the length of time of the music or during the particular exercise that you are doing. So music can be used as an integral part of treatment. Out of the disease state or of the hospital, music can equally be used for relaxation, for elation or inspiration. I'll share two examples here. There are some waiting rooms in commercial centers or in companies where jazz music is played in the background. You may notice it or not, but when you listen to that music, you feel relaxed, you feel at peace, you feel calm and quiet. That is because that music has a psychological and physiological effect on you. It is not there by accident. It is because they are making use of evidence that has been established by science. Secondly, in church, for some people, the most important period of the church service is not the sermon. I am sorry, it's not the sermon. for a majority of people, and again, this is evidence-based. You can contact me for the references I'm going to share with you. Some people, a good proportion of church attenders, go expecting a particular moment, and that moment, their most important moment, is the offertory period. Why? If I may ask you, why do you think the offertory is the most important moment? It's because it's a very joyous moment. There is music, there's dancing, there's positive energy, everybody is happy, people can liberate themselves from all the stress or the negativity that they have been going through during the week. So offertory is very important to them, and that importance is attached to the fact that there is music, dancing, and positive energy. Music as medical treatment, music as a therapy. This is so because music has the ability to stimulate the secretion of a very important hormone, endorphin. And endorphin can also be known as happiness hormone, that make us feel joyous, that make us feel happy, that make us feel relaxed. If you are wondering what kind of music could stimulate this effect on you, I encourage you to try out jazz music, to try out worship music for Christians, or to try out some classical music. You could equally share with us in the comment section the music that has helped you when you were ill, when you were feeling sad, when you were feeling anxious, so that other people can benefit from it. Thank you very much for listening to me to this point. And it was music as a medical therapy. See you another time for another episode of Medical Education.